Welcome to the Kona-Kohala Chamber of Commerce event with all kinds of great people here today. We are going to talk about West Hawaii's vaccination update. My name is Wendy Laros, and I'm the President and CEO of the Kona-Kohala Chamber. I do want to tell you a few things about the Chamber of Commerce. So we are located on the west side of Hawaii Island, and we represent businesses, organizations, and individuals in North Kohala, South Kohala, North Kona, and South Kona, those districts on the island of Hawaii. Our mission is to provide leadership and advocacy for a successful business environment in West Hawaii. Our vision is to enhance the quality of life for our community through a strong, sustainable economy. And our values are leadership, connection, education, aloha, and respect. Other way around, respect and aloha. I do want to give a shout out to our Ali'i Circle members. At the Mauna Kea level, we have Hawaii Community Federal Credit Union, KTA Superstores, and Hawaii Water Service. At the Mauna Loa level, Ali'i Circle members, Ultra Staffing, Bank of Hawaii, Barnett Consulting, Fairmont Orchid, and Hawaiian Electric. We also have Mauna Kea Resort, P&S Plumbing, Pro Service Hawaii, West Hawaii Community Health Center. And at the Hualalai level, we have Auto Body Hawaii, Creative Arts Hawaii, Kona Commons, BMW, HMAA, Simplicity HR, Big Island Collision Center, Jack's Diving Locker, and Pacific Waste. And what it is, this Ali'i Circle program, these are members who take the next step to help support the chamber so that we can actually fulfill our mission and achieve our goals. So thank you to our Ali'i Circle members. At this time, I'd like to introduce Clayton McGhan. He's the Executive Director of Ali'i Health Center. He's also our chair for the Kona-Kohala Chamber of Commerce Health and Wellness Committee. I'm going to go ahead and hand it over to Clayton.
Thank you, Wendy. Good morning and welcome, everyone. Thank you for attending the Kona-Kohala Chamber of Commerce West Hawai vaccination update. We're very pleased by your attendance. As we know, this is a very important topic this morning that has greatly affected each and every one of us. The Kona-Kohala Chamber of Commerce Health and Wellness Committee was initially formed as a working group in the middle of 2018. In 2019, the formal committee was formed with a singular goal to promote increased access to healthcare and wellness services in West Hawaii. As the healthcare climate has drastically evolved over the last 2 years, the Health and Wellness Committee has evolved and adjusted accordingly. And our objectives are, number one, to explore health and wellness issues and concerns of the chamber members and the community, support the local health and wellness industry and raise awareness of local resources, support a consistent and efficient approach to COVID-19 and other pandemic testing and safety measures. This morning, we have some topics that we'd like to discuss. Number one, the status of COVID-19 vaccinations in West Hawaii, mass vaccination sites, vaccinations at clinics, hospitals, and other sites, the registration process, VAMs, and any new information, any specific information for employers or businesses. And then most of all, looking ahead, the plans for short-term, mid-term, and long-term. We're very pleased today to have healthcare experts to inform us on the current vaccination initiatives within West Hawaii. I would like to introduce Jim Lee, Chief Executive Officer of Kona Community Hospital, Lisa Downing, Infection Prevention and Employee Health Director at Kona Community Hospital, Richard Taafe, the Chief Executive Officer of West Hawaii Community Health Center, Wayne Higaki, Queens North Hawaii Hospital, and then Jason De La Cruz, the State of Hawai Department of Health. To get things kicked off, I wanted to jump into, well, I guess today's moderators, are myself, We have Natasha Alla with West Hawai Community Health Center and another committee member, John Barnett. So real quick to get things started, one of the questions that we would like to ask our panelists is, what is the status of COVID-19 vaccinations in Hawaii and on Hawaii Island in West Hawaii specific? What's the current phase? How many people are being vaccinated in the state on the island? And how many people has each of your organizations vaccinated? So we could maybe start with Jim.
Here we go. Good morning, everyone. I just put together a couple of slides that I thought would help just give everybody up to speed with some general information. And just want to thank the Chamber of Commerce for putting this together because, again, as Clayton was saying, it's such an important topic, and there's nothing better than getting as much information out there as possible. So if you just bear with me. First of all, I wanted to say thank you. There's a couple of groups out there that have been really instrumental in making all of this come together. Community First Physicians, West Hawaii Family Community Health Center, which is on the panel this morning, Ali'i Health Center, Clayton and his staff have been doing an outstanding job supporting some of these mass vaccination clinics and testing the population here over the past year. The Department of Health, instrumental in making these programs a success and reaching out to those that are underserved and in difficult situations. Of course, the team here at Kona Community Hospital, it has been a monumental job putting up these clinics, and kudos to them. Certainly Civil Defense for providing some support as well, the Mayor's Office, the Parks and Recreation Department, and I'm sure I've missed somebody along the way here. I also wanted to give a shout out to our folks in East Hawaii. Hilo Medical Center has been doing an outstanding job standing up mass vaccination clinics, and as well as all of the East Hawaii providers. This is an island-wide initiative. And again, I just want to thank Community First Physicians for pulling all of these organizations together. And they do this on a weekly basis. They've been tireless about it. And, quite frankly, they've been asking and pushing on some of the difficult questions that we're trying to deal with as far as this vaccination program is concerned. Current DOH guidance. I'm not going to bore you with all this. You read about it every single day, but we're vaccinating everyone over 65, individuals with a number of comorbidities, and certainly all the workers in hotels, bars, and restaurants, and certainly frontline workers that are still out there waiting to be vaccinated. So that's where we are today as far as the DOH is concerned. This is a busy slide, but just to give you an idea of the population in Hawaii by these 5-year age groups. So right now we're looking at 65 and over, and as you can see, anywhere from 15, 16,000, 13,000, 12,000 people in each one of those groups. And that includes military personnel. And I mention that because the military are receiving their vaccinations, obviously, through the federal government. So there's about 163,000 population over 16 on the entire island. 74,000 vaccinations have been administered to date. And basically between Hilo and ourselves, or East and West, I should say, and all of the organizations that are providing vaccinations, we've been generating or giving out about 7,000 doses a week. These slides are just pulled from the DOH website. I know Jason should be on the call. Just kudos to the department, because if you haven't visited the site, I encourage all of you to do so. There's a great deal of information out there, and you get daily updates as to what's going on as far as the vaccination program here in Hawaii. The percent of total population vaccinated, 24% have received at least the initial vaccination. Total vaccines administered over, just about 74,000. On the next slide, you can see what the vaccinations have been by age group. 46% over 60, 73% over 75, and basically 29% of the population. And again, I urge you to go to the DOH website and check out some of this information. Some of the challenges that all of us are facing, outreach, how do we get to those individuals that are hard to get to, living at home or living in more remote areas? Vaccine hesitancy. We hear about this every single day, and some of the Pacific Islander populations, the Marshallese, they're particularly hesitant about getting the vaccination, and we need to reach out to them, and we need to work with all of those local groups in order to make the vaccinations happen. Filling pods, you may be hearing about the fact that we're scrambling to fill these large pods, and that is true. Until 2 days ago, and Lisa might talk about this a little bit later, but up until about 2 days ago, we only had 1,000 people for our 1,500 vaccination pod at the gymnasium. So again, that's a challenge for us, and resources are quite frankly a challenge as well. We've got lots of volunteers, but we do need some help managing our own resources. We have nurses and physicians and other clinical folks that are out there every single day for our pods that take place on Thursday, as well as the vaccinations we give out at the hospital every Wednesday and Friday. So that's a quick backdrop. I'm going to stop sharing and let the panel answer some questions for you. Thank you.
Great, thank you, Jim, for the update. So maybe we could hear from North Hawai, kind of your initiatives. What's the status of the vaccination in North Hawai in this efforts? What phase are you currently in? How many people has your organization vaccinated thus far?
Thank you, Clayton. Good morning to everyone. My name is Wayne Higaki. I'm the Assistant Administrator at North Hawai. Yesterday, we celebrated a pretty momentous occasion for us. Without the benefit of doing mass vaccinations, just doing Monday through Friday vaccinations, we did our 10,000th recipient yesterday. Pretty significant for us. The average is about 192 vaccinations per day. We are in 1 Charlie. We are following the state vaccination plan. And by the way, that's a modified 1 Charlie because initially 1 Charlie was age 72 and above, but the state amended that or revised it to age 70 and above. We are challenged in the same ways that Kona Community Hospital is with what Jim had previously mentioned. Resources, the human resource is of particular challenge for us. Being a small rural community hospital, we don't have the type of human resources that you might need for a venture like this. But we have now included those individuals with 65 and older, along with the medically fragile or the high-risk medical conditions, as Jim had mentioned earlier as well. It's been a really interesting adventure for us, but we have been exposed to the best sides of human beings. People are extremely grateful to be able to be vaccinated. And I know that all of the other healthcare organizations in the state of Hawaii share the same view, and that is, yes, we have these phases, but the sooner we can get everyone vaccinated, the better we're going to be as a community. And we hope that the state vaccination plan will be moving forward in that direction. That is my report, Clayton.
Thank you so much. Richard, if you don't mind giving us an update on West Hawai Community Health Center's efforts.
Thank you, Clayton. Can everyone hear me? Good. I'm sorry my video is not working. I'm not sure what's going on, but yeah, I want to thank the Chamber for hosting this, and certainly all the collaboration, and just echo what Jim said related to everyone working together in West Hawai and island-wide. This is an island community, and we are really working together. In terms of West Hawai Community Health Center, we vaccinated over 3,000 people to date. We have two things going on. We're vaccinating our patients on a daily basis, and that's through appointments. And that's usually in the mornings. We're averaging about 25 people to 30 people a day on that. And then we're participating in the community-wide vaccinations down at the gymnasium, which the hospital and DOH are participating in too. And we've been averaging for the 3 weeks, it's over 600. We expect this week, tomorrow, to be moving that to 800 vaccines. That it's a walk-in. It's no appointments required for that. So we're excited about that. And just like Wayne said, the appreciation that everybody has shown, the volunteers, the staff, and the people have come in and got vaccinated. It's incredible. It's heartwarming, and often many tears from people who've come in. So that's where we're at. In terms of numbers, in terms of population, clearly our Native Hawaiian Pacific Island community members have been severely impacted, even though they have a smaller percentage of the population in terms of the COVID. And so our vaccination rate, we've been trying to focus a little bit on those. So we're about 15% of people that we've vaccinated fall in our Pacific Islanders or Native Hawaiian. So we're going to be doing a lot more outreach within those communities in the coming weeks and months. That's all I'll report.
Thank you, Richard. Maybe we'll turn the time over due to time constraints to Natasha and John, who will continue on with some additional questions for the panel.
Great. Thanks, Clayton. So the next question is about the mass vaccination in Kona, kind of some follow-up questions. Everyone has a different process that they're using to get people enrolled and administer the vaccinations. Can the panelists please just talk a little bit about what the process is like for their organization? Maybe the hospital, do you want to go first? Lisa or Jim?
Hi, this is Lisa. Can you hear me?
Yep.
Okay. So the process for getting enrolled for vaccines at any one of our locations is typically you can call our hotline. And there's two different ways to actually get into the system. So you can either call the hotline, you can email one of the two different emails we have. And then we ask whether or not you would like to get a CDC link or whether or not you would like us just to make an appointment and enroll you. Some people are very particular about which way they want to go. They want the link, they want more control. So at the end of the day, we are actually submitting anybody that has given us their information into the system, and within 24 to 48 hours, they should have a link to the CDC. At that point, they are free to register and then book their own appointment. When that happens, they actually have access to any one of the pods that is in the VAM system. So DOH pod, a Hilo pod, anything that's published in the VAM system, they have free reign to book an appointment in. If we book their appointment, we book it strictly in our pods. We don't have access to book in the other ones. So we will book them either at KCH or at the downtown pod. And then at the end of the clinics, when they get through with their vaccination, they have the option for us to, again, book their second appointment for them, or they can go back onto VAMS and book their own appointment, their own second appointment. It's actually working quite well. We do see that there are a lot of people that would rather be at the Kona Hospital clinic. I'm actually quite surprised. But we've got a lot of people that are coming from down south that really don't want to drive into town. So our clinics up at the hospital tend to fill up fairly quickly with that population. And we do about 350 a day up there on Wednesdays and Fridays. And then again, like Jim had mentioned, we have a 1,500 capacity down here at the clinic downtown.
Great, thank you. Jason, are you on the call? Can you talk about the DOH efforts?
Yes, and hi, this is Jason from Department of Health. I want to thank all the partners too. We are running and have been running our pod at the Aquatic Center since about December. I think our first one was December 23rd. Cumulatively on island, we've done just shy of 17,000 vaccinations. Our West Hawai one, from those early beginnings when vaccine was extremely limited, we were only getting a couple hundred doses a week. Going forward, if we're able to sustain our Johnson & Johnson coming in and our current configuration, we're doing right around 2,700 vaccinations a week across 3 pods. And we're looking to increase that volume as well. Part of the state strategy in going through these tiers is largely based on inventory as well. There's been a lot of media interest about how states are performing and how efficient our states. And I'm very proud that the state of Hawaii is, I think, in the most current report coming out of Kaiser, we were ranked 4th out of the nation in terms of efficiency, and that's in terms of getting vaccine and then getting it out. Because this, it's one thing to be doing, receiving the vaccine. It's another thing to actually operationalizing it. So, that is kind of slowed us down in some ways across the state in terms of going through these tiers in an equitable way and a communication kind of management. But we're at the point where we're starting to see more and more vaccine come in. The Johnson & Johnson in particular, we were the only large mass vaccination clinic that had it. Those pods were done in East Hawaii just to simplify things, and we don't want to be carrying more than one vaccine type at a pod. But those vaccines disappeared within 2 weeks. We do see more Johnson & Johnson coming in, and as long as we can sustain that amount coming to us, we're hoping to be able to do a Johnson & Johnson clinic every week for about 1,010 people every Tuesday. So our pod numbers have some room to increase. I think that we are learning about what the aquatic center's full capacity is in terms of parking and how many people can be processed through that time. I think yesterday we were just under 800, on Tuesday, we were just under 800 vaccine appointments that day. And that's kind of maxing out and spilling out a little bit onto the highway. So we're kind of reviewing everybody's models and layouts and seeing what is the real full capacity of per hour for these sites, because it does get it starts affecting the traffic out there in general. So there is a lot of room to grow. I'm very pleased that West Hawai has, up in Kalakeakua has a site, has 3 options there. The KTA is also offering at some of their venues. And in addition to that, we've been giving, some operations for our West Hawaii team to do other small pods. So we've done some in senior housing and some other smaller operations, including some of the harder to reach agricultural communities as well. So there's a lot of capacity. There's a lot of partners out there. There's a lot of access points. I believe we in West Hawai, Kona Community Hospital are on VAMS, which means, it doesn't matter if Kona Community or Department of Health puts them in, or Hilo Medical Center for that reason. They can find a clinic on an island, on both sides of the island, or wherever a clinic is being advertised.
Great. Thanks, Jason, for that update. Richard,
Thank you.
would you like to speak about West Hawai Community Health Center's process at the mass vaccination clinic?
Yes, thank you, Natasha. At the mass vaccination clinic, which is every Friday down at the Aquatic Center, like Jason mentioned, we're doing just a walk-in. So it's a little bit different. We do have the Moderna vaccine, and anyone who walks in, and we screen them, so they have to meet the criteria, and we'll take them in, and we will process them and get them through, get them the vaccine, and when they leave, they get an appointment for their second dose. So they know by the time they come in, or leave, I should say, they know exactly when their next dose is. So we'll enter them into the VAM system after the fact. It's a pretty simple process, and people seem to be appreciative of that. So we've had a lot of walk-in folks who just say, wow, this was a lot easier. I do know and that one of the things we need to let the community know is that if they've registered in VAMS with another site, whether or not it's a hospital or a Department of Health, they're in that system and they need to follow up on that appointment and not walk into our clinic, because that creates confusion and other challenges for everybody. We can't enter them into VAMS because they're already in VAMS. It creates a vacancy or a missed appointment for the hospital or DOH that somebody else could have used. So, so to the general community, we need to make sure that if you have an appointment, keep it. If you don't have an appointment and you want to get vaccinated and you fall within the categories that are outlined by Jim earlier, you can come into the West Hawai Health Center on Fridays.
Great, thank you. Is John Barnett on the panel here? Would you like to ask the next questions, John?
Well, yeah, I was just, first of all, I was really touched with Richard's comment about the level of appreciation. And when you mentioned people tearing up as they get their vaccination, it's something I think we should all value and know how critical it is that people are feeling this. So Jason was the first to mention VAMS. Maybe somebody could just tell us, give a quick overview of what VAMS is. And Richard mentioned the fact that it's important to, if you have an appointment, keep it. So somebody maybe could expand that a bit.
I can take that on. So VAM stands for the Vaccine Administration Management System. It is a CDC developed software by obviously by some partners of theirs, but it's managed kind of by them. It allows us to do a few things. Number one, all vaccines in the state are being asked to be at least logged into VAMS. This is how Department of Health is really able to do some of that cross-cutting analysis and to get those numbers in almost real time. So from the provider standpoint, eventually that data has to get into VAMS, and it carries some demographic data, and it allows folks to do that, just a log. And so there are some parallel systems, like as you heard, with West Hawai, they're not using it to schedule per se, but they're adding that result and that log into VAMS. So that's communicated in a systematic way. And we have a statewide count, a county count, and a nationwide count. So that's, it's additional work. We all had to kind of learn that system, but in theory, it's a way that we can all work under that same system. From the recipient side, it allows the users to create an account. It is email based and it is a requirement. One of the nuances, it has to be a unique email for each recipient. And so let's say two spouses share the same email, that obviously won't work. So, I'm very happy that, Richard is offering, kind of these other alternatives. I know I've used it when folks are just having a real hard time doing electronic registration, and we're meeting capacity on our phone registration for our clinic. So from the scheduling standpoint, the nice thing is it automatically, meters out whether, which vaccine they got, and, whether they're getting it at 21 days, 28 days later, depending on which product, or if it's a Johnson and Johnson, it says that now have you been fully vaccinated with this particular vaccine. Users can then access their own health record through VAMS, which coming down the line, if they lose their little white CDC card that is proof of their vaccination, they can log into VAMS and access their record directly from the internet. So that's an added benefit. And it is a kind of a evolving system. Those that have been on it for a long time have been blessed by having a lot of updates and new utilities. But at the same time, it creates, things that we had never really thought about that create new issues. And, this is the first time, Richard, that I was hearing about kind of the effects on your guys' clinic if they are already registered in VAMS, because you're right, then they'd have a name, a date of birth, and so maybe some other demographic info. And then you're like, that's funny. You're already in the system and you may have an appointment somewhere else. So it does create these kind of unintended consequences. So the system, when it works really well. There is a learning curve to it though. And, just like the public, we've been having to kind of learn it and live with it. And we don't really have the full, power to request particular things in it or to change it or to alter it. So we're just kind of using it as is out of the box and then getting updates almost every week or two. So it is for those that can access it and know and can do it really well. It serves its purpose, but it does leave some technophobes really struggling to get through the registration process. Over.
Well, I got another question to the panel here. Is the rollout any different for employers and businesses if they want to take initiative and stimulate their own employees to be sure that they're vaccinated? What's the rollout there? That's it's a different level of a question, isn't it?
Yeah. Oh, well, I mean, I go ahead. Is that Lisa going to say something?
Yeah, I was going to chime in on that. So for us at KCH, and I know DOH was trying to help large businesses navigate early on by taking large lists from a lot of different employers. And then when their tier opened, they would go ahead and disperse those lists to some of the big pods, Hilo, us, to enter into the system. And then they would take, some lists and enter them in. I think that we've kind of moved past those lists at this point, and any public facing business at this point. So any business that is deemed an essential business where you have to go to work every day and you face the public and you have to report to work, you're not telecommuting. We consider you guys in the essential business category, and you can reach out to one of us and we will work with you to get all of your people registered and in VAMS and signed up. So you can provide us with lists of first name, last name, and then again, like Jason mentioned, that unique email address for everyone. And then we'll put you in VAMS, and then you'll get that email from the CDC, and you can register and sign up for your appointments. And then we will assist you in any navigational issues that you have. If you're stuck, if you can't get registered, if you didn't receive the link, if you're having problems with your computer, we help you navigate all of that if you're working with us as a business. So I think that we've been able to address a lot of the large businesses in the community, and we're kind of still picking up the smaller ones at this point, the onesie twosies, but the major businesses and the major operations have pretty much submitted a lot of their staff members to us already. So in those cases, I know that people have emailed me, Jason. They can always email the KCH vaccine email, and then we'll work with them to get these large lists together and get their businesses taken care of.
Okay.
Great, thanks. And kind of as a follow-up to that, our next question has to do with looking forward, where we're at, midterm, short-term, midterm, long-term, and on the track we're going here, how far are we from having everyone vaccinated?
This is Jason. I know that our numbers right now, are climbing up. I think that we're still dealing with some hesitancy, whether it's just temporary or really changing people's minds. Obviously, some estimates would put herd immunity, in the 70+% category. But we may not be able to hit that if hesitancy still remains low. And so as we move through these age bands or phases, we may be, getting those early adopters who want to get the vaccine and, are ready from day one. We have other people, and for those like, Lisa and I who have been working on these lists, it's not too uncommon to get a large list, and then every couple of days or weeks, you're getting additional people added in as people, change their minds or see their coworkers being fine. And they're like, okay, I'm going to get it now. I feel safer. Or maybe I'm just waiting for the Johnson & Johnson vaccine to come out. And so, these factors are coming into play. Obviously, we have a lot of age-based category. I think that would be an easy shift to do. And, we are making some progress on that, but we're trying to make sure that we have a steady flow of vaccine in, and we have all of those things in place. So it's hard to say, it was always never like, hey, we're out of 1B, let's move into 1C category. We always knew there would be a kind of a blended kind of interaction, and, and maybe some counties or sectors would be being more aggressive. If we have the pods and we have vaccine on island, obviously we want to be as efficient, and we want to be filling those up as much as possible. And so that's, I do really like the model that's working in West Hawai to have one centralized location, even though there's different operators, but there also is different access points and ways to get in, whether you're a VAMS users or not. So, we will be able to accommodate that, but, we want to know how much more do we have to do? How many more other providers on island, the smaller clinics, and, as our pharmacies are able to scale up in their volume that they receive, and what impact would that have in vaccinating this as well? But we may be getting into a phase where we get all of those early adopters in each sector or age group, and then we got to really start now changing people's minds that you really should get vaccinated, and the time is now. Go for it.
Yeah, and I want to just tag on to Jason here and say that we are in plans. We are starting to kind of meet and discuss what our next moves are when we get to the point where these mass pods are not full. So we don't have enough people that are interested in coming to these mass pods, and we're looking at, we've got the majority done, and we are looking at it kind of ramping down and doing more outreach, and what that's going to look like, who's going to do that, how we're going to facilitate that, how we will support that to get to these outlying areas. I know KCH, I go out to Kohala Hospital. It's now going to start being twice a month, but it was once a month. And we are doing just their community out there at Kohala Hospital. So I think that that's going to have to happen more as we move through these groups, and our big local pods are not filling up like they are now. Once the numbers start to dwindle a little bit, we'll have to start look at maybe, stopping those pods or absorbing those pods, and then doing more outreach. And we're all in talks right now about what that's going to look like, when that potentially is going to happen, and how that's going to work into what we're currently doing.
I have a question. Who's handling the publicity, like with the media and so on? Maybe Lisa, you could answer that.
I'm actually going to kick that one over to Judy if she's still on the line.
Okay.
Hi. Yes, I'm still here. We have kind of a multi-pronged effort going on. The Community First weekly planning meetings that Jim mentioned earlier has a subcommittee that is about communications, and that includes civil defense, East Hawaii, West Hawaii, the Department of Health, primarily. I don't recall if Natasha's been on that one. So that's kind of one place. So we're trying to roll out our messages at the same time. We're relying heavily on civil defense and the county to keep their websites caught up. As far as other messaging, until really just now, when we're looking at our pods maybe not being as full, we haven't had a need for messaging. I mean, we need to let people know the vaccines are safe, that they're here, what our clinic timeframes are, et cetera. But we haven't had to do a lot of outreach to invite people to come and get their vaccines. That we're just at the beginning of that right now, and we'll be setting a plan in place for that on the subcommittee.
Okay.
So does anyone else, any of the panelists have anything else they'd like to share before we open it up for questions?
This is Richard. I'd just like to mention in terms of our walk-in clinic, and I heard Jason talk about the fact that sometimes it gets backlogged because there's so many people. One of the things we found to be very effective, because it is a walk-in, there aren't appointments, that when somebody comes up, we screen them, but then we give them a time and for coming back. So at 10:15, so maybe they get there at 8 or 8:15 and say, okay, we're booked up, but here's one for 10:15, come back 15 minutes beforehand. So they can go off and do their business, and then they know they have a place. And that's worked very, very well. And I just wanted to mention that it's made the flow work very smoothly. We've had a consistent number of patients coming in. It's not a long wait, and it's just been very effective. In terms of the planning, I guess I'm going to ask a question to Jason about the Johnson & Johnson vaccine, because we're anxious to reach out, as Lisa just mentioned, to some of the hard to reach places. And I know Jason and Department of Health have been going out to various public housing projects. Because of our demographics and the patients we see, we're anxious to get out there, and we think that the Johnson & Johnson vaccine would be very effective in helping us to reach some of those hard to high at-risk folks. When do you think that you'll be getting more Johnson & Johnson and extending it to other community providers?
Sure, and I think that's a great question. You know, if we had that crystal ball, I think it's similar to what we experienced with both Moderna and Pfizer rollout. You know, obviously there is, you know, on the nationwide, if not global scale, in terms of wrapping up production of, you know, some of these vaccines, it is somewhat of a supply chain issue. You know, we got 2,000 doses allocated on that very first dispersal to the state. That didn't last very long. And the next week we had none. And then there was, I believe, 1,700 brought into state. And then now we're looking at 8,400 coming in for the next week. How much the Big Island gets, you know, I'm not sure. It's I think very early to say what will be that steady amount coming in, because, you know, we have some historical data about, you know, how, you know, what the logistics scheme for this is in transportation and production and distribution. So, you know, I'm thinking that it's going to be a, you know, very sketchy first couple of weeks until everybody gets their bearings straight on the Johnson & Johnson side. And then we might see a little bit more steady flow into it. You know, with AstraZeneca on the horizon as well, that's another possibility. We might have to do a lot more messaging about that with some of the current events going on about that as well. But, you know, that may be coming into play as well, and it may be mired the first couple of weeks in terms of distribution too. So, you know, I don't have a really good answer for that. I know that, you know, if it's for smaller operations, and, you know, the mantra is really, you know, if you're looking to use Johnson & Johnson out, you might want to, you know, have a defined plan and a date, because we're still kind of on this schedule of ordering for that particular week. So if you said, hey, Jason, I need 200 Johnson & Johnson for something we got going on next week. Can we get it? We may probably be able to do that, but what we don't want you to do is ask for the 200 and then go for some planning and not get that into arms for 3 weeks, because then, you know, it looks like we're just sitting on our doses. So, you know, we can probably, you know, have those discussions and, you know, issue out small amounts if it's coming to the district health office and then dispersing it out to others. We've done that with some providers already for smaller operations. But, you know, we from a public standing point, we you know, we may be looking at how we can get this out, you know, on both sides of the island. Like I said, we don't have any plans immediately to have a Johnson & Johnson only clinic in West Hawaii. But, you know, maybe with some of planning on your guys' ends and how we want to offer this out to the community, maybe one of us can transition over on certain days. I mean, you know, it's a possibility, but I don't think with the inventory we have, we can really stand up a large Johnson & Johnson pod on that side. But if you've got small needs, we may be able to accommodate that with some foresight.
Yeah, Jason, this is Lisa too. I just want to mention that it really, the planning on that, like you said, has to be pretty stout, because a lot of people are on the fence about Johnson & Johnson. So we need to make sure before we say, well, we're going to take, you know, 400 doses down to Milili'i of Johnson & Johnson, that they're actually willing to take Johnson & Johnson, and they don't feel that the only reason we're bringing it down there is because it's the 1 dose shot. So I think that you're right on when you're talking about planning for the Johnson & Johnson and how that fits into what we're currently doing and what the public and everybody really is asking for and wants. So we really need to be careful about doing too much planning before we get a pulse on where it's going to fit.
Thank you, everyone. We wanted to make sure we can get to some audience participation here. Real quick, quick housekeeping item. If you can, please raise your hand or feel free to use the chat option. We want to try to get to everyone's questions because this has been a lot of great information and very helpful in understanding what's happening here. So let's turn the time over to you all. Please feel free to raise your hand or type some questions in the chat, and we'll get these over to the panelists.
Doug, did you have a question? I saw Doug's hand up earlier. No, okay. Any questions from any of our audience members? So I see that we've got Dale on the line and Justin, Jonathan, Courtney, Leo.
I got a question.
Mm-hmm.
You mentioned herd immunity, and I heard that yesterday, and Senator Schatz had a webinar, and he was talking about that. What does herd immunity look like behaviorally for the community? Do we still wear masks? What does that mean about gatherings and that kind of thing?
This is Lisa from Kona. I'll start on that one. Jason, if you want to tag on and talk at the end. So what we look for with herd immunity is, of course, the tipping point of the majority of the population that is considered protected, and that's going to outnumber the ones that are not getting the vaccination or have not been fully vaccinated. And so at that point, I think that we will start getting mandates down from the CDC when they start looking at the nation as a whole, and the majority of the individuals in the nation that have been vaccinated. Once we've kind of hit that tipping point, I think that they will start looking at decreasing some of the requirements and the recommendations that they've put out. They may not drop it all at once. I know that some states have already looked at dropping masking mandates, and I think that we will still have this for quite some time. And then also we need to look at the effectiveness of the vaccine over long term. So we can talk about herd immunity, but if we start seeing that the vaccine has not proved to be effective for, after 6 months, 8 months, 10 months, and we might need a booster shot or something else, I would not say that the herd immunity is necessarily something to hang your hat on. It's definitely a goal that we want to reach. But I don't see things immediately dropping once we reach that goal. I don't know, Jason, do you want to say anything?
Yeah, just a lot of echoing those same things. Some states are rolling back some of those mandates. It's I think the cautionary tale right now is parts of Europe that are seeing some resurgence. Granted, now this is in the era of current vaccines, but we don't want to. It's probably going to be another kind of slow process. What exactly our state chooses to do in individual counties in terms of other restrictions or emergency declarations will largely be at that time. I think our state in particular has had kind of a very, very strong, somewhat unified approach on that. We've had some really unique opportunities out here in the middle of the Pacific to try some new strategies. We're the only probably state that can truly, isolate and set up a quarantine program like we've had. But that hasn't been without a cost and some challenges. So, I don't know how that really plays into the larger realm of herd immunity and how all these variants play into it. And does this something, when do we really put some of our guard down? We are talking kind of even right now about, well, do we stand down some of our isolation quarantine facilities that are still available and still have people in them every once in a while, but haven't been largely utilized since some of our peaks. So, when do we start doing that? When is the right time? I think those are the harder discussions. We all kind of want to get back to normal or whatever new normal is, but it's really a question of when. That's a really hard thing to forecast.
This is Jim Lee. I'm not a clinician, but I am very concerned about herd immunity and when and how we get there. I know our experience here at the hospital is that about 65% of our employees have taken the vaccine. Out in the population, it's going to be somewhat lower than that because of the vaccine hesitancy and because of the younger age groups, quite frankly, feeling a little more invincible and not getting the vaccine. So let's just say that at the end of the day, after we've given out all the vaccines we can, we're at 45, 50% as a state. How do you get to that 70% herd immunity or that 70% number that Dr. Fauci has talked about? So I think that our collective challenge here is to think about vaccine hesitancy, think about getting all of our employees on that list so that we can get them vaccinated, and to do our best to raise that number as high as we can, because it's the number of people who are vaccinated and the number of people who've been exposed to COVID-19 that go towards that 70% herd immunity. So I think that the heavy lifting is coming to get the vaccines out to remote parts of the island and to populations that don't want it, and to get them to understand why they should be vaccinated.
Great, thank you. Had another question from Lydia. Great question. Any information yet about side effects for people with controlled seizures or medication? This might be one for you, Lisa.
I'm sorry, Clayton, you kind of cut out. Can you repeat that one more time? I'm sorry.
Sure. Any information yet about side effects for people with controlled seizures on medication?
Like as in whether or not they should get the vaccine. So I think that anybody that has any specific questions on whether or not they should receive the vaccine because they're on specific medication or they have a specific condition should really get it evaluated by their physician before they go and get that vaccine. I think that there's nothing specific unless you've had anaphylactic shock to one of the components of the vaccine or a vaccine in the past that is contraindicated for you to get the vaccine. I don't think there's anything specific about a seizure history or seizure medications that would prevent you from getting the vaccine. Jason, does that sound about right?
Yeah, sounds about right. I mean, we have to remember that these are pretty new vaccines. There is ongoing safety studies. And some of those safety studies are in under 18 or 16 populations. So that might, give us a little bit more indication of, whether it's safe to be used in pediatric populations or younger. We have some safety evidence, and I think overwhelmingly there's been some rare circumstances going on, and these are where that VAERS system, which I don't think we've talked about that, but the VSafe program that we try to get people to enroll in after they've received a vaccination to report any adverse events gives us a little bit more information about what the frequency of any side effects are. Obviously, if something is very, leads to, a very bad adverse event, those are reported by the provider and cataloged, and we get a better sense of those. But just those smaller things, nuances, or what people are feeling and how they want to report that, there is a way to communicate that and kind of get that into the data pool, I guess you could say.
I have one question. We are getting about 3,000 visitors a day coming into Kona. Our responsibility, of course, is first of all the residents, but a lot of those 3,000 people are people who own a second home here, and are eligible to sign up for vaccinations also here?
From the Department of Health standpoint, if they are a resident or a part-time resident, that's great. We have had some leeway. We did have some Canadian nationals who owned a home in Waikoloa who were technically not US citizens, but are part of our community at least part of the year. And so, there is some wiggle room in there, but our allocations to the state are based on adult resident population. So we don't really want to advocate for vaccine tourism. We don't normally, let people jump in line if they're heading back, only here on a couple weeks vacation. Those are good questions to kind of ask, but we will maybe be able to relax on that once the inventory and allocations to states across the country are much higher.
Yeah, this is Lisa. We don't grill our people that are signing up. If they kind of meet the requirements to be vaccinated, then we're giving them vaccinations. I know that there's been a few that have gotten their first dose on the mainland and are here and need a second dose. And whether or not they're here because they have a home here or are here on a special assignment or whatever, we go ahead and do that, because the way that we look at it is it doesn't really make a difference if they are residents full-time here or not. They can carry COVID just the same. So if I have a captive audience and they are willing to get the vaccine and they are here and they are in our community and they fit in the current tier, we would like to get them vaccinated. So, that's kind of our philosophy. If I've got somebody that wants the vaccine and I've got a spot and it's not kicking out somebody else, we're going to go ahead and get them taken care of.
Great, thank you. Any other questions? All right, we'll turn the time back over to Wendy. Thanks again for everyone that attended and participated.
Yeah, thank you guys. Thank you, Clayton. Thank you, John. Thank you, Natasha. Yeah, thank you, Jim. And we've got Wayne and Richard and Jason and Lisa. We really appreciate you guys being here. So this was our West Hawaii vaccination update. We did record it. We will send it out to the membership. We've got about 1,100 people in our database, so we'll be sending it out, and such great information. We really appreciate it. And I just wanted to make sure that if anybody didn't know, we have lots of committees, including our Health and Wellness Committee. Thank you so much for hosting. And we have our scheduled meetings for next week in April. And we're also doing a member orientation on April 2nd, where if you don't have information about the chamber, even if you've been a member for a long time, you want some updates, we're going to be doing that next week. And with that, I'll go ahead and close our event and appreciate everybody attending. Thanks so much, everyone.
Thank you, Wendy.
Thank you.
Thank you, everybody.
Hello.